With the recent measles cases and the lingering effects of the post COVID era, the need for rapid and accurate disease diagnoses has never been more critical. Cary McNamara is the chief financial officer of HealthTrackRx. That's a company that many call the Amazon Prime of diagnostic testing for its test kits that offer next morning test results. Pretty amazing. Good morning to you, Cary. Thanks for coming on.
Morning, Ken.
You bet. How is HealthTracks RX addressing the challenges that we're seeing with outbreaks like measles?
Great question. For us, the way we address the outbreak and all disease states is through speed. We're a company that very simply provides diagnostic answers back to patients and caregivers and providers next morning. Like you had said, the Amazon Prime of healthcare diagnoses.
That's fascinating because time is of the essence. You don't want to have a virus like measles and go from place to place. Like we had a couple of cases here in New Jersey in the last few months where somebody had the symptoms but didn't do a home test and they literally went to an urgent care, then the next day went to a hospital, then the next day went to their doctor, and in the process potentially spread that virus. And measles is very contagious, obviously. He could have spread that virus to every place he went. So this is something perfect for a home test. You can get the test, do the home test, see if you have it. If you have it, confine yourself to the home and not spread it. Now, measles, of course, we just said, is a virus. Many doctors, though, have been warning about the misuse and overuse of antibiotics when it comes to bacterial infections, whole different animal. But how does Health Track RX tackle that issue?
That's exactly right. The misuse and the overuse of antibiotics has become rampant in the U.S. and it's really a result of kind of the last 50 years of the way we've practiced healthcare, which is going to see your provider if you are sick is kind of tantamount to receiving a prescription for an antibiotic at the end. But
How
not all diseases need an antibiotic. And not all antibiotics will react the same way to every disease. And so, if you walk into an urgent care and your urgent care utilizes health tracks, what will happen is we'll receive a swab or a sample gathered through either a throat or a nose swab, and it's sent to our lab in Louisville overnight, and we'll result your sample. And your physician will then have data to inform their decision making. What is the best antibiotic? Do you need an antibiotic? And so we are driving speed to results and we are driving tailored healthcare. And to kind of expound a little further, Ken, the reason it's important is exactly as you said. The rise or the increase in antibiotic prescribing has kind of given breadth to what we've all heard of as superbugs, and those aren't great. And so, by being proactive in how we prescribe and what we utilize antibiotics for, is one of our best frontline defenses against future superbug evolution.
So people could have a virus that cannot be treated. Obviously, viruses cannot be treated with antibiotics, even though people say, well, give me something. Well, they can't really. Maybe a decongestant, right? If you have a viral infection of your chest or sinuses or whatever. But I guess in certain cases, they'll give antibiotics to prevent a further bacterial infection from a fluid buildup or something. But at least the doctor knows or the prescriber knows to make that judgment if they get a quick response from this test. Can people order the test on their own, or do they need a prescription to get the test sent to them, or how does that
Great.
work?
Great question. You don't need a prescription. We predominantly serve urgent cares and pediatric offices. So if you wake up with a congestion or you wake up and your child has a runny nose, going to your local pediatrics office or your local urgent care is where you're going to find our solution. It does have to be provider administered. And what we do is your provider will administer the test. That provider in office will send that test to us via UPS overnight. And our laboratory sits on the end of UPS's runway in Louisville. It's very cool. And we will provide a very detailed report back to your provider the next morning that lets them know what you might have, what your child might have, if you're taking care of your parents, what your parents might have. And the provider is then able, with speed, to make a very tailored and informed, data informed care path.
So that answers the next question, because the next question was, how does your company get these test results delivered both accurately and quickly? And so you literally, in the as the UPS plane lands, your lab is right there. So you don't have to wait that extra day for the package to get from where UPS lands at that airport to your office, because your office is the airport. That's just
That's
brilliant.
right. We hear
Unbelievable.
diagnostics and we think extreme complexity. If you boil this down, what our company does is there's really four steps to the process. Um, you walk in, or you walk in with your child to an urgent care, and your provider will take a swab, and that swab is HealthTrack's. So, swab to the nose, swab to the throat. It is put in a UPS bag at the end of the day. That's kind of step two. And the UPS provider, UPS big brown truck driver, will pick up the package, take it to the airport. They'll put it on a UPS plane. UPS plane flies to Louisville each evening. Step three is it's off the plane and it's in our lab, and we're resulting that sample at 1 or 2 a.m. And it's about a 7 hour process. So by the time your provider gets back to work at 9 or 10, or back into the office around 9 or 10 in the morning, they have the answers that they need around as it relates to what are you positive or negative for, what's going to be the most effective antibiotic. And then, for all of us, when we are sick, all we care about is getting healthy again. And so,
Right.
with the right answers, you are on your way to being healthier faster.
I just want to make sure we have the website and all correct, Cary. So we're saying Health Tracks, but it's Health Track RX, what you say Health Tracks, right? I want to make
You,
sure we have
you,
it correct, so the doctors who want to get in touch with you can do so. So what is your website for everybody?
it's healthtrackrx.com. And, as you said, Ken, we provide care or provide diagnostic solutions to about 5,000 care settings in the US, about 15,000 physicians. And most importantly, we impact 2.5 million patients annually.
I love it.
So we're in a lot of your local urgent cares, a lot of your local pediatrics. And when you walk in, if you say, we want the peace of mind that a health track test will afford, now you know who sits behind the diagnostic solutions.
Brilliant, brilliant. So hopefully some of the different urgent medical treatment centers in our listening and viewing area will know that they have this great alternative to get practically immediate results within 12 to 18 hours. That's pretty amazing with HealthTrack RX. Cary McNamara, Chief Financial Officer of HealthTracks. Thank you so much for joining us, and thank you for your company and what it does. We appreciate you.
Thank you, Ken. Appreciate it.